Hi, everyone. My name is Carol Wilcock, and I was supposed to be able to meet this month with Thermography of Montana. And I really wanted to highlight them and educate you about, and have them educate you about thermography and what it is that they offer. And so they come here 2 or 3 times a year to Dynamic Health. We just let them use our space so that our clients have easy access to their services. And because of a lot of different things happening at the same time, they weren't able to meet with us. But for those of you who don't know what thermography is, I wanted to be able to just share my screen and share some images with you so that you can see what thermography looks like and just have a brief explanation of what that is. So I'm going to go ahead and share my screen here with a lot of things you don't need to see. There we go. Okay, so first of all, this is not one of my clients. This is a picture that I'm just using that I found interesting because I did have a client with a similar situation. Hers was actually just a narrow space in one of her legs. And it turned out to be, it was a place of great deal of pain. And she took it to her vascular surgeon, and he was able to correct it really quickly in a place where she's like, I have this crazy pain and nothing's wrong. And he looked at it and went, oh, well, clearly there is something wrong, and was able to repair it. So sometimes just having a good visual of what's going on. So visually, this is taking a picture of the temperature of your skin. And of course, you can see below that as well. So anything in the dark colors is cooler, right? The blue is cold. The red is hot. The white is white hot. And so this is a pretty typical picture of an area where there's some trauma, some inflammation. With Thermography of Montana, they'll take a picture and then they'll send it to a physician who's been trained in reading thermography. I am not that person. You'll read a report, right? You'll get a report from them, and they can really do any part of the body. So typically, they use it a great deal for people with wanting to make sure that there's no issues with breast cancer. And with thermography, they'll look at an area of concern, if it's a great deal of concern, and then they'll recommend that you do further diagnostic imaging. So you could do an MRI or a mammogram. And I highly recommend the MRI. It's incredible clarity for soft tissues. Plus, it doesn't have any radiation, as well as the thermography. So it's literally just a camera that's taking a picture of heat, right? Heat and cold. So you can see where there's an area of concern, and then you'd want to follow up. This is some low back sciatic, right? This is low back pain, and you can see exactly where this would look like it hurts. And I have seen this many, many times. So again, obviously an area of concern. So then it's a matter of working with your physician, working with the recommendations from the physician who reads the thermography, if this is something that you need in order to have good diagnostics. You can do a full body. You can do just the chest, right? Breast and chest. You can do a whole person. So you can see as you go through some of the images that you can do thermography of a whole person. But I've had clients where it'll show up an immense amount of sinus congestion and sinus inflammation. And they were like, oh, I just thought I had, that was just my airway. I didn't realize that it was hot and inflamed. So knowledge is power. I always like people to know and see what's going on. Here, you take a picture, by the way, just so you know, you take a picture with no clothes on, whatever area of skin, because we're taking a picture of the temperature. You need to not have clothes on. It's a private piece. They're super professional. And you're taking a picture at a distance. They're really just looking at the screen from the camera point of view. They're not watching you directly. They're always looking at the screen. and making sure that they have a good clear image. So if you're interested in scheduling with Thermography of Montana, you can call Connie at 406, and let me do this. Let me stop my share. There we go. And I'm going to put this in the chat so that you can see it. So for those of you who are listening and not writing this down, but you can call Connie, and she controls the schedule. We don't schedule for them. They control their own schedule. They will be here May 1st, 2nd, and I believe the 3rd, but the May 1st and 2nd for sure. And you can call them and get scheduled so that if you want to take an image of an area of concern, they can help you with that. It's also great to have a baseline, so you know what normal is, and then you can see if there's any changes or shifts. So if you're in your 30s or 40s, 50s, and you haven't ever done a thermography and you want a baseline thermography scan, it's really a great idea to do that. So there's Connie's information. So again, that's Connie with Thermography of Montana. So with that, the other piece I just want to mention, if you guys didn't see the newsletter for this month, there's some really great, well, I hope you enjoyed it for starters, because it was super fun and funny to share, but and to play with. But I wanted to highlight for you and just remind you that we have this kind of no joke special dealing with long COVID, and it's really not a laughing matter at all. And there's really great research on EECP for long COVID, and there's also great research on hyperbaric for long COVID. And there are maybe a handful. There's very few places in the world that have both. And then you throw in the biofeedback and the detoxing foot baths and all of that. So we can really help you and your loved ones with long COVID. So the practice or the special here is 20 of the EECP, and then we added in the 5 hyperbarics and 3 biofeedbacks, and all of those with an aqua chi at the same time of your biofeedback, and then 2 of our bath bombs. So you can see that this is a great tool. Normally, those would be $4,775 at their regular prices. And so what we did is we took this and trimmed. You guys, we know that things are tough. We get it, and we're trying to help for the least amount we possibly can. So this is $2,300 down from $4,775. So I don't think we've ever had a hyperbaric EECP combination that was so incredibly affordable. This is super affordable. So we're really committed to helping you with that. And while this is up, I want to be able to share some of these articles. So this is people who have experienced EECP in helping with their COVID-19 symptoms. They did over 1,500 cardiac patients. Fatigue was reduced by 36%, and the breathing difficulty was reduced in half. And that's without hyperbaric, right? So that's just using EECP. And then this article is actually from the American Cardiology Association. So this is a PubMed article, or American College of Cardiology, sorry. So enhanced external counterpulsation offers a potential treatment for long COVID. And it's a really great article on how this has been just really, really great. So the analysis here found statistically that it improved their health status in so many different ways. So the functionality, the fatigue, the shortness of breath, their walking capacity, all of these things were a huge improvement. And then last, I wanted to share this piece on hyperbaric that improves neurocognitive functions and symptoms of post-COVID. So this is a trial that they did, and this was this was really a fascinating article that I encourage you to read. So clinical outcomes were associated with significant improvement in brain MRI perfusion and microstructural changes. Okay. And so these results indicate that hyperbaric can induce neuroplasticity and improve cognitive, psychiatric, fatigue, sleep and pain symptoms of patients suffering post-COVID-19. The hyperbaric's beneficial effect may be attributed to increase brain perfusion and neuroplasticities in regions associated with cognitive and emotional roles. But that is true of all of us, not just post-COVID. So it does increase neuroplasticity and perfusion. So if your brain is not functioning the way that you want it to, it's hard to have a clear mind if you have a frumpy brain. So if you really want to improve that cognition, the fatigue, the sleep, all of those things, by having better energy during the day, being able to relax at night, and the hyperbaric is amazing at this particular piece. And I'm glad that they're recognizing it with COVID, but it's true of all different situations where people want to improve their cognition, want to improve your health. It does increase your stem cells. There's a lot of research on hyperbaric and stem cells. So it does increase your stem cell production so that no matter what you're looking to recover from, you can do that quicker with hyperbaric. Our upright hyperbaric should be back any day for those of you that are looking forward to having that. It just went in for a zipper repair. But we should have it back here shortly and be able to get you in, and we're super excited to have you. So give us a call. All you have to do is make an appointment, call before the end of the month. You don't have to make the appointment before the end of the month. Just call and we'll save that price for you. Okay. All right. On the special. I hope that helps. And I hope that you are able to maybe think about some thermography if you haven't thought about that before. Always some good new tools that we just want to make sure you're aware of. I hope you're having a wonderful April, and we'll see you in May. Take care.